Hello everyone, this is Madhu Roberts, Cardiology Fellow from University of Tennessee, Knoxville, and I'm here in Chicago attending ACC 2016, and I have a great pleasure to be here with Dr. Emmanuel Brilakis, who is a faculty and pretty much guru of CTOs. Hi Dr. Brilakis.
Hello Madhu, thanks for the invitation.
Thank you very much for giving us this time to talk with you. Now, we are representing here fellows in training specifically, and so, being in your position, what advice would you have for fellows in training who want to get established in an academic career?
Great question. Well, I think it's a great time. People are saying it's a bad time for interventional cardiologists. I think it's a great time for being an academic interventional cardiologist. Jobs are not as many, but there are so many things that are starting or evolving right now. There's complex coronary interventions, there's the structural field, and both of them are still developing. There's a lot of room for publications and research to be done. So the advice is the standard: work hard. It's ideally to find an area you like and focus on it and try to publish as much as you can. And more than anything else, try to learn. I think everything comes from learning. The more you learn, the more you publish, the better you become in general.
That is great advice. Thank you very much. At ACC 2016, what is the most exciting science you'll be taking home with you?
Great question. Well, I'm biased, so CTO world obviously is doing very well. Had some great live cases. I think on the scientific part, Partner 2A, that was an amazing trial, and everyone was predicting the results that moderate risk patients would do well just with TAVR versus surgical replacement. So I think that's opened the door for people to do more percutaneous valve procedures. That's going to change our practice eventually.
Okay. You do a lot of CTOs. So where do you see the future of CTOs to be, like in, for example, next 3 to 5 years?
Great question. The CTOs are developing. There's much more consensus now on what to do and how to do it. I think currently probably the main challenge in the field is how to make things simpler and done by more operators. There are many people who do a great job, but there are people who are still in the learning phase. So the question is how to bring everyone to be able to get higher success rates and lower complication rates. So education is going to be part of that. And I think for the fellows, there's a lot of development for the need of maybe some little extra training in the complex intervention, the so-called CHIP, which CTO is a big part of. There's already three programs. There's one in Colombia, one in Mid-America, one in University of Washington in Seattle. So there's a new breed of complex interventionalists going on that will be a nice field to develop and a great opportunity for people to do academically well and clinically well as well.
Oh, great. That's actually good information. Now, my final, question is your final few words of wisdom for everybody pretty much in cardiology who's now beginning their careers right now, whether they want to be in academia or private practice, but want to be their best.
Be their best.
Be their best.
Well, I think for me, the real excitement, to give you an example, I was reviewing some cases for the fellows review course, and it was about the basilic vein and cephalic vein. Mm-hmm. And I hadn't really thought much about it, and I learned that the cephalic is not very good for radial right heart cath because it gets a steep angle and it's hard to get back into the right heart. And that was a great revelation. I really enjoyed it and made me very happy. I think you're going to be happy where you are, and I think learning makes you happy, and doing a good job makes you happy. So whatever you do, keep on learning and doing the best you can, and they will be happy.
Perfect. Thank you so much, Dr. Brilakis, for your time. It was a great pleasure. Thank you so much.